Sole of the foot means plantar surface. The sole of the foot is bottom of the foot, referred to the plantar surface. Yes, we have some extrinsic muscles and some intrinsic muscles. Intrinsic muscle in the foot, extrinsic muscle in the foot. It means intrinsic muscle start and finish in the plantar surface. Origin, insertion. Intrinsic. But extrinsic muscles, they start from leg, other place, thigh, just finish at the foot. They are extrinsic. Examples for extrinsic muscles. Extrinsic muscle of the foot. Examples. Tibialis posterior. Flexor digitorum longus. Flexor hallucis longus. Pronos longus, very good. Flexor digitorum longus. So these are 4 muscles. 3 from posterior side of the leg. Flexor digitorum longus. Flexor hallucis longus, again posterior compartment. And tibialis posterior. These are muscles for posterior compartment of the leg, but attached, insert to the plantar surface. So they are extrinsic muscle of the foot. One muscle from lateral compartment, fibularis longus or pronos longus, goes to the plantar surface. So these are 4 extrinsic muscles. We're talking about them in the plantar surface. How many muscles we have in the plantar surface as intrinsic muscle?
10.
Extrinsic is 4.
10.
Intrinsic is 10. We have 10 small muscles in the plantar surface. They are in 4 layers. They are located in the 4 layers. The superficial layer is first layer. Then you go deep. Second, third, and 4th layer. Dorsal side of the foot. We talked about that. We have one muscle. This muscle has 2 parts. We can consider 2 names, 2 muscles. I told you. One part attached to the great toe. We call it extensor hallucis brevis. One part attached to the toes number 2, 3, 4. Just 2, 3, 4. We say extensor digitorum brevis. The first question, what is the innervation for extensor digitorum brevis? Deep peroneal nerve or deep fibular nerve, same to the anterior compartment. Dorsal side, extensor digitorum brevis, innervated by deep peroneal nerve.
And the cleft.
When you say cleft is about the skin, sensory. Yes, it's deep fibular, correct. So the medial part attached to the great toe, extensor hallucis longus. The lateral part attached to the second, third, and number 4, extensor digitorum brevis. Dorsal side of the foot, we just have these intrinsic muscles. Other muscles are extrinsic. Tibialis anterior, extensor digitorum, extensor hallucis, peroneus tertius. Lateral part, look at here. The innervation, both of them deep peroneal nerve or deep fibular nerve. We know that. Let's go to the plantar surface. In plantar surface, like palmar surface, we have an aponeurosis. It's from deep fascia. In plantar surface, palmar surface, it was look like a triangle. Again here, it's look like a triangle. It's look like a triangle. What is the name of this aponeurosis? Plantar aponeurosis. What is the benefit of this layer here?
Protect the deep structure.
Yes, protect the artery, nerves, tendons.
Original first affects the skin.
So, protect the deep structures, artery, nerves, give the origin for some muscles, attach the skin to the deep structures, It's like plantar surface. You know that in plantar surface you have a skin, a small superficial fascia, then deep fascia covering the muscles. Plantar oponeurosis is a part of deep fascia. We're talking about the deep fascia here and superficial fascia. So look at here. Plantar surface or sole of the foot, it has arch. I told you. In the normal condition, your foot plantar surface, it has arch, 3 arches. 2 longitudinal, medial longitudinal, lateral longitudinal. Longitudinal means totally, yes. 1 medial side, 1 lateral side. These are arch. 1 arch passing transversally. Yes, passing transversally. So look at here. This is lateral longitudinal. This one, medial longitudinal, and 1 transverse arch. Arch are made by bones. Arch of the foot, they are formed by bones. Look at here, look at the medial arch. Bones, which bones? First metatarsals, medial cuneiform, the medial side of the foot. They making arch. Lateral arch or medial arch? Which of them goes top, higher? Medial. Medial arch goes higher. Look at here. Look at the lateral arch, it's a little flat. Again, bones making the arch. Medial, lateral, transverse. And some muscles we had in the muscle of the leg. When they passing from the bones, for example, pronus longus, passing transversally here. So it can help this arch, maintain this arch. Some muscles attached to the medial side, so helps the medial arch. Some muscles attached to the lateral side, so helps maintain the lateral arch, okay? This is the story. Some people, they have problem. Their foot is completely flat. Their foot is completely flat. Say flattened foot or flat arch, flat foot. When they put the foot on the ground, all surface of the foot attached to the ground. So why the arch are important? I told you, for controlling your weight without pain, the bones location for jumping, running, standing, all of them. And we need this arrangement. So if you don't have this arrangement, these people usually they can walk, for example, for half an hour, 1 hour. They feel a lot of pain. The bones in the foot, the calcaneus, the muscles. So they have a lot of problem. This is the normal step when you put your foot on the ground. This is the shape of the flat foot, all surface attached to the ground. Now look at this one. One very rare condition, the arch is very high, where it goes up. A hollow foot, empty foot, it means hollow foot or high arch. You can see here.
What is the problem of the hollow arch?
Again, the problem is in the bones. When your bone is normal, you have this arch. When the arrangement of the bone is not normal, so your foot is flat. Sometimes the arrangement of the bone is not normal, the arch goes up. So the normal condition is okay. The flat condition or high arch, so this person needs.
Is it affected of a person?
Yes, absolutely, yes. They can step back easily because they have very top arch. Sense of the plantar surface, it's not very difficult. We had one question, I told you. Plantar surface of the foot, most region, high region, is by medial plantar nerve. 1, 2, 3, half of the 4. Again, 3.5 in the hand, I told you. 1, 2, 3, and half of the 4. Median nerve, half of the 4, and 5, 1.5, ulnar nerve. Dorsal side, 1.5. radial nerve, 1.5 medial ulnar. In the foot dorsal side, we don't have this rule. We just say all part superficial fibular nerve sensory, all dorsal side superficial fibular nerve except the cleft between great toe and second toe, except here, deep fibular nerve. But in plantar surface, again, we have that rule. 3.5, 1.5. 3. Toes, number 1, 2, 3.5 of the 4. The medial, because number 1 is medial. 1, 2, 3, half of the 4, 3.5. So they are medial, we have medial plantar nerve. Half of the number 4 and number 5, 1.5 lateral plantar nerve. What is medial plantar and lateral plantar nerves?
Branch of tibial nerve.
Yes, you know that. Posterior compartment of the leg, muscles, artery, nerve, all of them, they go to the plantar surface by passing from the tarsal tunnel. All of them going to the plantar surface. So what was the nerve for posterior compartment? Tibial nerve. Tibial nerve goes to the plantar surface. When this nerve goes to the plantar surface from posterior compartment, very soon divides to the two nerves, two branches. Medial and lateral plantar nerve. What is the artery? Posterior tibial artery. Posterior tibial artery. For posterior compartment of the leg. Posterior tibial artery. It looks like the nerve. Posterior tibial artery from posterior compartment goes to the plantar surface, divides through two branch. Again, same. Medial plantar artery, medial plantar nerve. Look at the artery and nerves. What happened here?
They are closer to the margin of the.
Which of them?
Both of them. The arteries are closer to the margin.
Very good. The artery divides sooner than nerve. So medial plantar artery is very medial. Lateral plantar artery very lateral. They're close to the margin, outside. Medial and lateral. But look at the nerve, black color.
Inside.
Divides after the artery. So the nerves, they are inside of the artery. This is lateral plantar nerve. Lateral plantar nerve. This one, lateral plantar artery. This one, medial plantar nerve. This one, medial plantar artery. Okay? So the arteries, they are very medial and very lateral. But the nerves, they are close to the center. So the question, most of the students answered wrong. I don't know. What is the relation between medial plantar nerve and medial plantar artery? So the artery is very medial. The nerve is lateral to the artery. Medial plantar nerve is lateral to the medial plantar artery. Okay? Again, we have it in the foot. So, two nerves here we have, medial plantar or lateral plantar. You know that we have this rule, 3.5, 1.5. So, toes number 1, 2, 3, and half of the 4. The skin here, 1, medial plantar and the plantar surface. But for half of the number 4 and number 5, lateral plantar. Question. One question today we had. What is the sense of the skin, second finger, plantar surface, third finger, third toes? Third toes completely medial plantar nerve. The skin of the third toe, completely medial plantar nerve. If I ask you toes number 4, you say both.
Medial side, medial.
Lateral side, lateral. We have this rule, I told you the previous session, the most medial side of the foot, no matter dorsal surface or plantar surface, the most medial side, saphenous nerve. Most lateral side, sural nerve.
Not that or those.
Both of them. When you say medial, it's here. You can see from plantar and dorsal, medial side. Lateral side, dorsal and plantar. Most medial and lateral structure. What is the sense of the heel? We had it.
Medial calcaneal.
Sense of the heel, I told you, in the posterior compartment of the leg. It's a branch of the tibial nerve, medial calcaneal branch. It's here. Medial calcaneal branch of the tibial nerve. Sense of the heel. Okay? So in this picture you can see it's very easy to understand what happened here. So we had two questions. Most part of the skin in the plantar surface, medial plantar. Toes number 3, again medial plantar. Previously we had one question, sense of the heel, medial calcaneal branch of the tibial nerve. So these points, they are important. After skin, you have superficial fascia. What we have in the superficial fascia? Superficial structures, nerves, veins, is a structure. And we have one ligament in superficial fascia. Superficial transverse metatarsal ligament. It's here, between metatars, between head of the metatars. It's here. Between the head of the metatars. The word superficial, it's very obvious. Superficial transverse metatarsal ligament. So it's coming from superficial fascia. We have another ligament here, deep transverse metatarsal ligament. That's one from deep fascia.
The second.
This one from the deep fascia, superficial transverse from superficial. We had one question. Because these three structures, they are formed by deep fascia. Plantar aponeurosis, deep transverse metatarsal ligament, and flexor sheaths, fibrous flexor sheaths. So the question was, all of the following structures, they are formed by deep fascia, except this one. Superficial transverse metatarsal is by superficial fascia. So let's superficial transverse metatarsal ligament. Where is the location here? Between head of the metatars. This ligament attached to the head of the metatars. Head of the metatars means distal end. Okay? So what are the deep structures here we have? First of all, plantar aponeurosis, like palmar aponeurosis. It's here. This triangle.